I've written several books, and Vaccine Safety Manual is my latest, and I'm just going to discuss a few things. I'm going to talk about the flu vaccines in general, swine flu vaccine in particular, and vitamin D as well. There's not much difference between seasonal flu and swine flu. They're basically just a subtype influenza A. Okay, it's got some minor differences, but we're not really going to have time to talk about that. I do want to mention that the statistics that the CDC bandies about 36,000 deaths annually are totally bogus. If you go to the CDC's actual National Vital Statistics reports, which is the official listing of the deaths, you'll find that there's maybe 1,000, 1,500, 2,000 deaths annually that are attributed to flu. Scare tactics. I want to point out that in October 2005, the British Medical Journal actually broke ranks with the medical industry, and they actually published a special report criticizing the CDC for what they called marketing campaign of their marketing campaign of fear. Okay, and they, the CDC, and I document this in my books. The CDC actually has secret meetings where they discuss ways to actually inspire fear in all of us. Okay, to be able to sell more of the vaccine. And the British Medical Journal broke some of this story, but I actually had some of the actual. The minutes of the actual meetings that they've held, but they do predict. They teach how to predict dire outcomes, how to emphasize deadly strains, and the British Medical Journal, like I said, they basically said CDC flu deaths are basically for public relations. There are 6 manufacturers right now that are producing influenza vaccines. And they contain, depending on which ones you take, they do still contain high concentrations of mercury, formaldehyde, hydrocortisone, MSG, polysorbate 80, and pig gelatin. They use gelatin as a stabilizer in several vaccines. As far as vaccine safety, GBS, Guillain-Barré syndrome, is a pretty common, side effect. I mean, it's basically a muscular paralytic disorder, and it's pretty common after all flu vaccines. So that would be the same with swine flu. They know it, that we're going to have X number of people, are going to, succumb to that. The vaccine also causes convulsions, thrombocytopenia, which is a blood disorder, and asthma and a few other things. Lots of other things. February 2005 issue of The Lancet did a study, and they found clear evidence of systematic suppression of safety data. Okay, which is pretty significant. I also did some research, and I found out that before the vaccine was recommended, in 1993, the CDC started recommending the flu vaccines for babies 2 years and under. Okay, they didn't do, actually under 5 years of age. They weren't doing that until 2003. Well, I got the statistics. In 1999, there were 25 deaths due to flu. Okay, in children 5 years and under. In 2000, there were 19 deaths. In 2001, there were 13 deaths. In 2002, there were 12 deaths. In 2003, the CDC began advocating that all children 5 years and under begin receiving the flu vaccine. And that year, flu deaths jumped to 90 deaths that year, a 7-fold increase. Okay. As far as vaccine efficacy, February 2005 issue of The Lancet, it was a master's study. They studied all previous pertinent studies relating to flu vaccines. Okay. They found no evidence that flu vaccines prevent flu in children under 2 years of age. There's no convincing evidence that flu vaccines can reduce mortality, hospital admissions, serious complications, or community transmission of influenza. The lead researchers concluded immunizations of very young children does not lend support by our findings. 2006, the Cochrane collaboration did all relevant studies, 51 studies of 260,000 children, found that vaccines were in 2 to 5 year olds were just 35% effective, under 2 years old, 0% effective again. October 2008, Archives of Pediatrics and Adolescent Medicine, study of children could not demonstrate vaccine effectiveness. And I know I'm blitzing through this, but I do want to get to the vitamin D, which is pretty significant. Healthy adults, 25 master study of 25 previous studies. Universal immunization of healthy adults is not supported by the data. Elderly, 65, they did a master study, 64 studies, all the pertinent studies around the world over the last 40 years. Master studies found influenza vaccines were not significantly effective against influenza or pneumonia. Okay, so those are the studies. And then again, in October 2006, the British Medical Journal did a master study of all pertinent studies. Flu vaccines have little or no effect on influenza campaign objectives. They had no effect on hospital stay, time off work, no effect on death. They were ineffective in children, adults, and the elderly. They were not beneficial to healthcare workers to protect their patients. Okay, so that covers that. Swine flu, I want to talk about swine flu now. Okay, an unpublished Canadian study was just released. I think the lead authors leaked the information because it was hush-hush. Okay, not too many people know about this, and the media hasn't picked up on this. This just occurred just a few days ago. Okay, and what they discovered in Canada was that people that received last year's seasonal flu vaccine were twice as likely to get swine flu this year. Okay, the CDC right now is doing everything they can behind the scenes to put a lid on this story. We'll see what happens with that. Okay, well, I'm going to get right into 80% of the swine flu vaccines are going to contain mercury, but I do want to talk about vitamin D. 2006 December issue of Epidemiology and Infection. Vitamin D deficiency weakens the immune system, creating susceptibility to influenza. Okay, now I want to talk about another study that just was released a week ago. In central Wisconsin, in June, there was an outbreak of swine flu in a healthcare facility. There were 275 patients in that facility that for the past several years, their blood levels were monitored for vitamin D, and they were supplemented with vitamin D. 2 of those people caught swine flu. Okay, that's 0.73%, less than 1%. 0.75% caught it. There were 800 staff members. Of those 800 staff members who did not have vitamin D supplementation, 60 caught it. 7.5%, a tenfold increase. That's highly significant. Okay, and there's a lot of other studies. And here's the link. Let me just mention this link. The sun, we produce vitamin D from the sun. In the winter, there's less sun. We're less exposed to the sun. We're not producing vitamin D. There's less sun in the winter, and there's also less sun as we move towards away from the equator, north and south latitude. Okay, that's the link. So we need to be supplementing with vitamin D. The science is there. It's maybe much more significant than vitamin C and almost any other vitamin that we could think of right now. Probably I would recommend 2,000 to 4,000 international units daily, and they're finding, I've got a study here, that it may be even beneficial for treatment. Once you catch it in the early stages, you can bump up to 30,000 to 50,000 international units as a treatment protocol. Thank you.